And now I'm pleased to introduce our first speaker. It's Dr. Sheila Prindiville from the NCI. Sheila is here today to update us on the NCI and VA Interagency Group to Accelerate Trials Enrollment, or NAVIGATE program. NAVIGATE is a partnership between NCI and VA aimed at accruing more veterans onto NCI cancer trials. It was launched in July at 12 VA centers across the country, or at least announced. Since I ran for SWOG chair in a campaign to get the VA hospitals re-involved with cooperative research, you know that this issue is close to my heart. In fact, I'm honored to serve on the NAVIGATE steering committee. Please welcome Dr. Prindiville to the podium to talk about this exciting new clinical trials effort. Thank you so much for coming.
Thank you for inviting me here today to speak on behalf of the new partnership between the NCI and the VA. Again, I'm delighted to be speaking about this, but it's really on the behalf of many people who have worked on this. As Chuck mentioned, NAVIGATE is an acronym for this new partnership between the NCI and VA Interagency Group to Accelerate Trials Enrollment. So this is a collaboration between the NCI and the VA to facilitate enrollment of veterans into NCI national clinical trials. It's also an opportunity for government agencies to partner at the national level to make clinical trials more accessible and accelerate cancer research by testing new cancer therapies, lessen the burden of cancer and its symptoms, as well as novel approaches to prevention and the early detection of cancer. So some background about how we actually got to where we are with NAVIGATE. As many as you know, VA medical centers are part of an extensive healthcare delivery system and have substantial expertise in the treatment of cancer. Many of them have actually been participating in SWOG trials over time. Also, the VA Cooperative Studies Program within the VA has developed and effectively utilized a centralized approach to address site-level challenges and to more efficiently recruit patients to national trials. VAs have historically been involved in NCI clinical trials, but participation has declined over the last decade for a variety of reasons. And of course, inclusion of more VA patients in relevant NCTN and NCORE clinical trials really is likely to advance the health of veterans and aid NCI's national system in completing clinical trials more rapidly. But one of the things that really led to this, I think, is probably most importantly, is there has been a real renewed interest among VA and NCI leadership to reinvigorate VA participation in NCI clinical trials. And in many ways, I feel SWOG really has been leading the way in this, really with many things that Chuck has championed over the last 5 years with the creation of the SWOG Hope Foundation VA integration program, as well as your very strong VA working group. There's been a lot of things shared over time just within SWOG to really say how can we actually improve accrual from veterans into our national clinical trials. And so I really do want to thank you for that efforts. So let me tell you a little bit about what the cancer incidence is at the VA systems. And then this is a slide, again, this is based on 2010 data. It's the most recent data that was published in 2017, which I received from my VA colleague, Mike Kelly. But as you can see, there's about 50,000 cases of cancer diagnosed across the VA systems, about 45,000 or so of that is invasive cancer. You'll note on the left that down here that there's about 20% of the accrual is actually from African American Black populations. Additionally, you'll see that the VAs are accruing cancer incidents all across the country. And then the age-adjusted rates are approximately slightly higher rates of cancer, but not really much more so than in the general U.S. population. And as one might expect, these are the cancers that actually occur by sex in VA patients. You can see that the vast majority are occurring among men, although there are 1,300 cases in women, as we're having more women veterans over time. Additionally, the cancers that you see are prostate, lung, colorectal, and kidney are the top number of cancers that you see in VA populations, which is what you may actually expect or have seen yourselves clinically. So one of the things we also did was to look to see what the VA accrual has been to NCTN trials over the first 4 years of the NCTN grants. And as you can see, there's about 100 accruals per year currently to NCTN trials. And interestingly, that's coming from 35 VA sites that have at least one accrual. And then looking within that, 6 sites actually contributed more than half of the accrual to this number. There's 424 accruals over the past 4 years. Additionally, over half the sites really have less than 5 accruals. So there's a lot of interest in it, but there's really some sites that are having much more success with accrual. Additionally, as you'll see, though, it's on the right that of the accrual, approximately 28% of it was from Black populations to NCTN trials. And then similar as what one would have expected with the lead diseases for these are mostly to prostate, lung, myeloma, head, neck, and colorectal cancers, similar to what the slide that I showed you previously about what the cancer incident populations are in the VA. Now, why has our accrual gone down? Right, so there's 2 things. One is actually trial activation challenges, and then some barriers that are specific to patients. But really, the trial activation challenges is really what the Navigate program is focusing on. And it's including our regulatory issues of use of technology, data sharing, as well as associated information security, tissue banking issues, really lack of personnel and resources for dedicated recruitment. And then, of course, there's a lot of variability around the processes for conducting trials among VA sites. No single VA is actually quite the same. So with that in mind, we worked to put together the Navigate program. And what this program is designed to do is to increase veteran participation in NCI national clinical trials, to enhance operational activities to reduce barriers and facilitate participation of VA sites in NCTN and NCOR trials, and really most importantly, to enable sustained long-term capability for VA participation in NCTN and NCOR trials beyond the initial Navigate support period. The primary activities supported by Navigate include the establishment of a consortium of VA sites and a central coordinating office focused on increasing VA participation in NCTN and NCOR trials. What is really done is providing from NCI to the VA infrastructure support to support 12 VA sites for dedicated research staff for recruitment and enrollment. This was one of the number one identified reasons why the VAs were not able to actually sustain the accrual that they had over periods of time. So this program is providing $150,000 total cost per site annually for 3 years. Again, the costs that are not supported by this, because they're covered by our standard research mechanisms, is NCI will use our mechanisms for research costs associated with trial, providing investigation agents, as well as research testing, and the VA will continue to provide standard non-research medical care for eligible veterans in accordance with their policies. So what are the components of Navigate? There are 12 VA sites. There's a coordinating center. And then importantly, there's a steering committee. And the steering committee is really operational people from both within the VA, as well as centrally from the VA in Boston, the Maverick Center, as well the Cooperative Studies Program, as well as from NCI. And what this group is doing is we've been meeting regularly for the past 2 years to ways to be able to provide guidance and assistance to the coordinating center and sites with trying to overcome system-wide and site-level barriers, such as central IRB utilization, data collection, information security, and other issues related with launching a trial. And then secondly, we also have formed an executive leadership committee. Really, this is at the leadership level to champion, navigate activities with stakeholders, review the overall program progress, and really help facilitate policy and operational changes when it really takes key leadership at the VA and NCI to be able to do that. And then just on this slide, I just want to let you know who's actually on this executive leadership committee. And in one way, we actually have Dr. Blinky, who's actually on the committee here because of the experience with SWOG. But really, we have senior NCI people on this. Jim Doroshow chairs this committee with Rachel Ramoni. Rachel Ramoni is from the Central Office of Research and Development at the VA. And the two of them have been really key in helping us move this program forward, as well as making policy changes when they'll be needed. So of those 12 sites, you can see on this map here, these are the 12 sites that were funded through the Navigate program. We had, the VA ran a RFA for this, and there was a substantial interest. There were over 45 sites that applied for this. We only had funding for 12. The yellow stars here, though, I do want to point out, these are a VA Integration Support Initiative, SWOG, Hope Foundation awardees that actually 5 of them did become Navigate sites. And then the coordinating center, as I mentioned, is the VA Maverick in Boston. And then on this slide here, this is so you all, if you just list a list of who the PIs are at those sites, if you're looking over at the right, you'll probably notice that there are several SWOG investigators that are here. So if you see them, you know, they've all really successfully competed for this program. And we just had a meeting in the VA working group here. And I think there was a lot of enthusiasm and a lot of really sharing of best practices amongst these VA investigators. But most importantly, you know, we're viewing we're viewing the Navigate system as a network, really not just the 12 funded sites. We really, you know, because there were many people and lots of enthusiasm among VAs for conducting these trials, we were able to fund 12 of them, but we really would like to be able to share practices with all of the VAs that are actually interested in conducting sites. And as I mentioned previously, we know there are sites that are doing our NCTN trials because 35 VAs actually have contributed accrual in the past 4 years. And so our plan is once the Navigate is fully operational, we're at the very early phases. We just had our first kickoff meeting, but our plan is to include any interested VA site in our Navigate best practices teleconferences addressing their trial operational barriers. And again, this just goes back to the accrual slide that I previously showed you about the 424 accruals that occurred over the first 4 years of the NCTN grant. And the thing that I found interesting when I put this together is I wanted to see how much of that accrual came from the funded Navigate sites and how much of it came from other sites. And so if you'll see to the far right, in red is the accrual that came from the Navigate sites. But there's a substantial amount of accrual that you can see in blue that came from the non-funded sites. And so I think it's really important that we continue to engage with all of the VA sites to maintain our great, you know, when we're working on accrual and sharing best practices, because while the 12 sites are really important for this program, it's really important that we continue to work with all of the VAs that are contributing accrual as well as helping with best practices. So here are some of the recent activities. As I mentioned, this program has really just started. There was a press release in July. That really was interesting how much was actually picked up on that. There were multiple articles in the print media as well as electronically, and the NCI Office of Media estimated that it reached a target audience of over 2.7 million readers, which seemed surprising to me, but that was their estimate. And then we recently had a Navigate kickoff meeting in September of 2018. And at that meeting, what I was really struck with, you know, we brought all the VA investigators together. We really learned that there's a lot of variability amongst these different VA sites and a lot of enthusiasm actually really to work together. There are some really dedicated and committed investigators that are part of this program. And one of the things I think was of interest to SWOG, because of the lung cancer incidence in the VA population, there were a couple of sites that had lung map up and running. But this group came together and said, we're going to use the lung map and other lung trials as a model to see if we can actually share best practices and help each other and other VAs get that study up and running. So again, I think there's a lot of sharing amongst these investigators. Something else I think is very important is this idea of working centrally, right? The Cooperative Studies program at the VA has a central office, and one of the issues for all the local sites has been information security. And recently, as of just last week, as I understand, the central office actually has security individuals identified for technology, and they've developed a guidance document to facilitate the release of VA research data to non-VA entities and look at external web portal reviews. And the idea here really is centrally. This is what Navigate's about, centrally trying to come over barriers. And so at the central level that they will help provide guidance to the local ISO officers that are having to review all the protocols for data exchange. And then finally, one of the things we've done is we noticed it was really hard to find all the VA trials on clinicaltrials.gov because the VA could be Virginia and VA could be lots of different things in the way it's actually cataloged. And so on NCI's cancer.gov, we had the capability of creating a VA tag so that you could actually find what trials are open at a VA and only at a VA. And so one investigator potentially could talk to another investigator if you wanted to know where you could refer your patient to. So on NCI's cancer.gov search interface, you can find active NCI-supported cancer clinical trials, and there's now a tag on our advanced search form that allows limiting searches to VA facilities. The thing about this, though, is, again, we have to know what VAs are actually conducting trials, because up until this point in time, there hasn't been a central place to know about all the trials that are actually taking place at the VA. Of course, we know through the NCTN and NCORE trials, but there are other trials that are actually taking place at VAs. And then this is just a screenshot of the cancer.gov website, but you can see what's in the circle. You can limit the results to VA facilities. Okay, so in conclusion, this is, I think, some of the things that we have discussed here. We really hope that this Navigate program will increase access for veterans with cancer to our clinical trials, which are really considered the state-of-the-art care. We hope to accelerate accrual to our NCTN and NCORE trials. And it's really, as you'll see, we're about 20% of the patient population as a minority, and we hope this will be a way of offering ways for minority populations within the VA to participate in NCI-supported trials. And again, our investigators, we want to increase participation of VA clinical investigators in clinical cancer research, as well as enhancing VA's overall leadership role in cancer care and clinical research. And finally, again, this is the members of the VA Steering Committee that I really want to extend my thanks to, because while I'm one person who's speaking about this program, really there are many people. Grant Wong in the Cooperative Studies program at the VA has been my partner in this from the VA, actually, in helping oversee all of this activity, along with Andrea Denikoff from NCI and Marge Good, who I know many of you know for years, who have worked on things with SWOG, as particularly VA issues. And then other people from the Cooperative Studies program, including Mary Brophy and Sarah Schiller and Colleen Shannon, who are also here today. So I really want to thank all of them, because really I wouldn't be up here speaking about that without all of their help. So that's all I have.